Have you ever considered the potential dangers of getting up to use the bathroom during the night? Typically, people don't pay much attention to their nighttime routines, but as we age, small errors can have serious repercussions. The reality is that specific habits after the age of 70 can silently elevate the risk of falls, cardiac issues, and other medical emergencies, sometimes resulting in tragic outcomes. In this video, we will discuss 5 nighttime habits that seniors should steer clear of. While these habits may appear harmless, they can place additional strain on the body, making it more susceptible during the night. By acknowledging these risks and making minor adjustments, you can safeguard your health and sleep more securely. Stick around until the end, as the final habit on this list is something that many individuals engage in without realizing its potential dangers. Let's delve into it. To begin, one of the most perilous habits that seniors can develop is rising too rapidly from bed after being in a lying position. Although it may seem insignificant, the consequences on the body can be sudden and severe. With age, our ability to regulate blood pressure becomes less efficient, making us more susceptible to orthostatic hypotension, a rapid drop in blood pressure upon standing. This can result in dizziness, loss of balance, and, in many instances, unforeseen falls. A fall during the night can be catastrophic for seniors, leading to fractures, head injuries, or worse. The issue lies in the fact that these symptoms do not always manifest immediately. Some individuals may stand up and feel fine briefly, only to suddenly experience fainting or loss of coordination with their first step. This poses a significant risk when getting up to use the bathroom at night. Transitioning from a relaxed state while lying down to standing up abruptly places immediate stress on the cardiovascular system, prompting the heart to work harder to adapt. If the heart is unable to respond promptly, the brain may experience a brief lack of oxygen, resulting in dizziness or even fainting. For instance, let's consider Charles, a 75-year-old who had always been self-sufficient and never thought twice about his nightly trips to the bathroom. One evening, he woke up as usual, swiftly got out of bed, and stood up. Before he could take another step, his vision blurred, and within moments, he lost consciousness, hitting his head on the nightstand before collapsing to the floor. Upon regaining consciousness, he was disoriented and in pain. It was later revealed that the sudden drop in blood pressure caused him to faint, and he was fortunate to escape serious brain injury. The key to preventing such falls is straightforward, yet effective. Allow your body time to adjust. Instead of leaping out of bed immediately, take a moment to fully awaken. Upon waking up, remain lying down for a few extra seconds. Take a few deep breaths, then slowly transition to a seated position, resting there momentarily. This provides your body with the time needed to stabilize blood pressure before standing up. Once you feel steady, place both feet firmly on the ground, use a stable surface for support if necessary, and rise gradually. If you frequently experience dizziness or instability when getting up, it may be worth examining whether any medications you are taking contribute to low blood pressure. Certain medications such as blood pressure medications, diuretics, and certain sleep aids can exacerbate the issue. Always ensure a bedside lamp or nightlight is within reach to navigate safely. If you have encountered sudden dizziness at night, consider discussing it with your physician. A simple adjustment in your getting up routine can make a significant difference in averting a hazardous fall. Next, consuming excessive fluids before bedtime can have adverse effects. While staying hydrated is crucial for overall well-being, drinking excessive water before retiring for the night can be detrimental, particularly for seniors. As we age, the body's ability to regulate and process fluids efficiently diminishes. This means that consuming large quantities of water in the evening can lead to frequent nocturnal bathroom trips, disrupting sleep and heightening the risk of dehydration, electrolyte imbalances, and even perilous falls during the night. Nocturia, a condition characterized by frequent nighttime urination, is one of the primary concerns. Many seniors struggle with this issue without recognizing the role their fluid intake before bedtime plays. When the bladder rapidly fills up, it sends urgent signals to the brain, prompting multiple awakenings solely for relieving oneself. This constant interruption of sleep impacts more than just rest. It weakens the immune system, strains the heart, and accelerates the aging process. As we age, our bodies become less efficient at regulating temperature, making it harder to stay warm during sleep. A drop in body temperature at night can restrict blood circulation, increase the risk of strokes and heart strain, and even lead to respiratory issues. What feels like a slightly chilly room during the day can become dangerously cold during the night when the body's metabolism naturally slows down. One of the biggest dangers of sleeping in a cold room is vasoconstriction, where blood vessels narrow to conserve heat. For seniors with existing heart conditions, this process can place extra stress on the heart, increasing the risk of high blood pressure, irregular heartbeats, or even heart attacks while sleeping. Additionally, cold temperatures can cause blood to thicken slightly, making clot formation more likely, which raises the risk of strokes. Even mild exposure to cold night after night can gradually wear on the cardiovascular system, leading to unexpected complications over time. Another overlooked risk is how cold temperatures can weaken the immune system. The body works hard to maintain a steady internal temperature, and when it's exposed to excessive cold, immune function slows down. This can make seniors more vulnerable to colds, flu, and respiratory infections, which can be more severe or last longer in older adults. Sleeping in a cold environment with dry air can also cause nasal passages to dry out, leading to increased congestion, sinus issues, and a higher risk of respiratory infections. Take Walter, for example. At 77, he preferred sleeping in a cool room and would often lower the thermostat before bed. Over time, he started waking up feeling stiff with mild headaches and occasional shortness of breath. At first, he didn't think much of it, but after experiencing chest discomfort on a particularly cold night, he decided to consult his doctor. It turned out that the combination of his heart condition and the cold nighttime temperatures was putting excess strain on his cardiovascular system. By adjusting the temperature in his bedroom and using additional blankets instead of lowering the thermostat, he was able to sleep more comfortably without added health risks. To minimize these dangers, it's important to maintain a stable and moderate bedroom temperature. Ideally, seniors should keep their room comfortably warm, but not too hot, around a temperature that allows them to sleep soundly without feeling cold. Instead of lowering the thermostat drastically, consider adding extra layers such as warm blankets, socks, or thermal sleepwear to stay warm. Using a humidifier can also help maintain air moisture levels and reduce the risk of respiratory irritation. For individuals with circulation issues or arthritis, keeping a warm water bottle near the feet or wearing light gloves while sleeping can help regulate body temperature. These minor adjustments can prevent unnecessary strain on the heart and immune system while improving sleep quality. Being mindful of nighttime temperatures can have a significant impact on long-term health and well-being. Ignoring mild chest discomfort or shortness of breath at night can be a dangerous mistake for seniors. These warning signs, although seemingly minor, can sometimes be the first indication of a more serious underlying issue, such as a heart attack or stroke. It is crucial not to dismiss these symptoms, as they can be early indicators of life-threatening conditions that require immediate attention. Symptoms may not always manifest in the expected way, and failure to seek help promptly can have fatal consequences, particularly during the night or early morning hours when the body is most vulnerable. Eating a heavy meal right before bedtime, a habit many people enjoy, can have adverse effects on seniors' health. Consuming a large meal too close to bedtime can trigger acid reflux, disrupt digestion, and increase the risk of complications such as aspiration pneumonia or heart strain. The body's nighttime metabolism slows down, making it challenging to efficiently process heavy meals, leading to discomfort, poor sleep quality, and potential long-term health issues. It is essential for seniors to be mindful of their eating habits before bedtime to avoid these risks and maintain overall well-being. One of the immediate risks associated with consuming a heavy meal before going to bed is acid reflux, also known as gastroesophageal reflux disease, GERD. When you lay down with a full stomach, stomach acid can easily flow back into the esophagus, leading to symptoms such as heartburn, coughing, and irritation. Over time, this repeated acid exposure can result in inflammation, ulcers, and even an increased risk of esophageal cancer. For seniors who already have digestive issues, the effects can be exacerbated, making it challenging to get a good night's sleep and causing chronic discomfort. However, acid reflux is not the only concern when it comes to eating large meals late at night. This practice can also place unnecessary strain on the heart and circulatory system. The process of digesting a substantial meal requires increased blood flow to the stomach, which can temporarily divert blood away from other vital organs. This diversion can lead to a drop in blood pressure, causing some seniors to feel lightheaded or fatigued. In individuals with existing heart conditions, this added stress can contribute to irregular heartbeats or an increased risk of heart failure over time. Another serious but often overlooked danger is silent aspiration, a condition where small amounts of food or stomach acid accidentally enter the airways instead of the digestive tract. This occurrence is more likely when lying down soon after eating, especially in seniors who may have weakened swallowing reflexes. Repeated episodes of silent aspiration can lead to chronic lung irritation, infections, and even aspiration pneumonia, which is a life-threatening condition for older adults. To illustrate, consider Gerald, a 73-year-old who enjoyed his evening meals and frequently ate late due to his irregular schedule. One night, after consuming a large dinner, he experienced mild discomfort but ignored it and went to bed. A few hours later, he woke up coughing and feeling breathless. Unbeknownst to him, some stomach acid had entered his airways, causing irritation in his lungs. Over time, he developed a chronic cough and occasional wheezing, leading his doctor to diagnose him with aspiration-related respiratory issues and advise him to change his eating habits to prevent further complications. The best approach to mitigate these risks is to time your meals appropriately. Instead of having a substantial meal right before bed, aim to finish your last significant meal at least 2 to 3 hours before lying down. If hunger strikes late at night, opt for a light, easily digestible snack like a banana, yogurt, or a handful of nuts instead of a full meal. Elevating your head slightly with an adjustable bed or extra pillow can also help prevent acid reflux during sleep. Implementing these simple adjustments can enhance digestion, support heart health, and decrease the likelihood of nighttime respiratory issues. Small changes in your evening routine can have a significant impact on safeguarding your health and ensuring a more restful sleep. In conclusion, as we conclude this discussion, take a moment to contemplate the 5 nighttime habits we have explored. While some may appear innocuous, they can gradually elevate health risks, particularly for seniors. Fortunately, minor adjustments can yield substantial benefits. By modifying your nighttime habits, you can safeguard your heart, enhance sleep quality, and reduce the risk of unforeseen medical emergencies. Which of these habits surprised you the most? Have you encountered any nighttime health-related issues previously? We welcome your feedback. Your experiences could assist others who may be unaware of the associated risks. Preserving your health entails not only daytime practices but also nighttime choices. Your body requires time to recuperate, and making informed decisions during the night can promote strength and wellness in the long run. If you are uncertain about how a specific habit may impact you, do not hesitate to consult your doctor. It is always preferable to err on the side of caution. Thank you for being with us today. We value your input. Feel free to leave a comment below, sharing one key takeaway from today's discussion and how you intend to apply it in your life. Your thoughts are invaluable to us, so please do not hesitate to share them. Your comments serve as a source of motivation and encouragement for us. If you found this content helpful and informative, please like, subscribe, and share. Your support enables us to continue producing valuable content to educate and inspire you. Thank you for watching, and we anticipate your presence in the next video.